my name is Sasha Kimbrough, and I will be talking about the neurotherapeutic effects of Apis mellifera venom acupuncture therapy for Parkinson's disease. The Apis mellifera is the model organism and is also known as the Western European honeybee. They are primarily native to Europe, Asia, and the Middle East. Honeybees are not native to the U.S. Workers will usually live anywhere from 30 to 60 days. Drones will live for about 21 to 32 days, and queens will live for 1 to 2 years. Polymorphism in bees is the differentiation between castes. Polyethism in bees is shown in the different tasks performed at different ages, and honeybees are eusocial insects, which means they work as a collective to maintain the hive. So bee venom comes from the sting, which is a modified ovipositors, and only the female bees can sting. The venom is produced by the epidermal glands or the venom glands and is stored in venom sacs. The side effects of getting stung by a bee is itching, swelling, and allergic reaction. If you are allergic to bee venom, you may experience trouble breathing, tightness of throat, dizziness, nausea, vomiting, diarrhea, etc. Bee venom is often used in acupuncture therapy to help with arthritis, inflammation, Alzheimer's disease, central nervous system diseases, Parkinson's disease, and more. Apitherapy is the use of bee products such as venom, propolis, honey, beeswax, royal jelly, and pollen for medicinal purposes. Bee venom is used to help lessen symptoms as well as decrease the further development of diseases. Propolis has antibacterial, antiviral, antiparasitic, and anti-cancer properties, as well as being able to treat autoimmune diseases. Honey is used for healing wounds and treating allergies. Royal jelly is good for wound treatment and has antibacterial and antifungal properties. Bee pollen can be used as an antidepressant and can improve brain, liver, heart, and prostate functions. Parkinson's disease is a neurodegenerative disease that causes uncontrollable movements. This includes shaking, having difficulty with balance, stiffness, and tremors. People of older ages are more likely to be affected by Parkinson's disease, but people younger than 50 can still develop it. Some of the causes include loss of nerve cells in the substantia nigra, which is the part of the brain responsible for producing dopamine. There really is no explanation that causes the loss of nerve cells. Also being exposed to the neurotoxin MPTP, which destroys the dopamine receptors in the substantia nigra, certain pesticides and environmental toxins, and head injury. So symptoms typically start to develop when about 50% of the nerve cell activity within the substantia nigra has been lost. Early symptoms include constipation, acting out dreams while having rapid eye movements in sleep, depression, hyposmia, as well as shoulder pain. This disease can last for decades, and it affects 1 in 1,000 people over the age of 60. This brings us to the question, can venom from Apis mellifera be used as a neuroprotective agent in people suffering from Parkinson's disease? In this study, researchers used 9-week-old mice and injected them with the neurotoxin MPTP, which causes Parkinson's disease, as well as saline. They injected the mice with the MPTP or the saline every 3.5 days for 5 weeks. The mice were given high and low dosages of bee venom or apimin to see how it affected the mice's brain lesions. The bee venom was able to protect the dopamine neurons from the MPTP. As seen in the figure, it shows the effect of bee venom expressed by allele and apimin expressed by APAM injections to fight MPTP. The first graph shows the number of tyrosine hydroxylase cells expressed in the mice's brain when given saline or MPTP. Tyrosine hydroxylase is rate-limiting enzymes that are expressed in the dopamine neurons. It can be seen that the mice given saline have a higher cell count than those exposed to MPTP. This is because the mice with the saline have all of their normal brain functions, whereas the mice exposed to MPTP do not. In the second graph, it shows the dopamine levels in the striatum in the mice given saline and the mice given MPTP. The third graph shows the homovanillic acid and dopamine neuron ratios in mice injected with saline and MPTP. It showed that the mice with the MPTP had higher levels of homovanillic acid and dopamine neurons when given the bee venom and apamine treatment. This study showed that bee venom can protect dopamine neurons from MPTP. In this study, researchers also used mice to see if bee venom would help lessen the effects of Parkinson's disease. It was proven that bee venom helped prevent dopamine neuron death in the mice injected with the MPTP. In the figure, we can see that the mice with MPTP that were given the bee venom had more tyrosine hydroxylase cells than that of the mice with the MPTP that were given phosphate buffered saline. In the graphs, M plus B represents the mice with MPTP that were given bee venom. M represents the mice with MPTP that were given the phosphate buffered saline. B represents the mice given saline with bee venom, and C represents the mice given saline with phosphate buffered saline, thus showing the neuroprotective effects bee venom has on an MPTP affected brain. In this study, researchers used a group of 43 people that had Parkinson's disease. They were treated with acupuncture or bee venom for 8 weeks to see the effects it had on their mobility. People treated with bee venom saw significant improvement in their mobility skills. The patients were also able to have faster walking times when asked to walk 30 meters, as well as their overall rating of how they felt, which can be expressed by UPDRS. There was also significant improvement in the patient's depression, and the study helped give more information about the positive effects bee venom acupuncture has when treating Parkinson's disease. In the 3 studies mentioned, bee venom acupuncture has been an effective treatment for Parkinson's disease. The use of honeybee venom in these studies has proven its ability to help improve depression, ability to walk, and prevent dopamine neurons from dying. Bee venom provides a good alternative to conventional treatment, such as medications, which can cause negative side effects such as dizziness, nausea, and headaches. The research done is significant because the venom used from Apis mellifera has been proven effective in treating Parkinson's disease, so it could be used to treat other neurodegenerative diseases in the future. Bee venom is naturally derived, and you can extract the venom without killing the bees. And more research on using bee venom to treat Parkinson's disease could be done because most studies I found were on mice. Using more human patients in the future could help make bee venom acupuncture an important treatment for Parkinson's disease.